Welcome to the FemiNinja Project. I am your host, Cheryl Ilove, middle-aged ninja hiding in plain sight, dedicated to restoring human dignity one person at a time and helping you unleash your personal power. Discover that it's possible to look like a woman, act like a lady, move like a ninja, and think like a warrior. And remember, men are always welcome on the FemiNinja Project. Welcome to another episode of the FemiNinja Project, and thank you so much for tuning in. I really appreciate it. And one of the things I love to do is explore some of the options in alternative health, alternative medicine, and share some of these ideas and these finds with you so you understand that we have options. There are a lot of times that we think we might be stuck with a problem, stuck with hot flashes, stuck with weight gain, stuck with aches and pains, and maybe we're not getting the answers that we want or that we need. We're going to talk to somebody today who's got a really fascinating story, and he knows an awful lot about functional medicine, and he's going to share it with us. His name is Alex Yampolsky. Alex, welcome to the show. Thank you so much for being here with us.
Thanks, Cheryl. Excited to be here. Excited to share my story.
Well, I'm excited to hear your story and everything, all the information that you have for us. And I'm also really excited to have another man on the show.
That's right. Manpower.
I'm all about that. So you have such a compelling story. You actually came to the United States at a young age, correct?
Yeah. We moved here with my family when I was 13. It's quite an adventure. I'm
sure. And you learned English really quickly.
Yeah, well, being the youngest one in my family and going to school full time, I was really immersed in the culture and the language, so I caught on the fastest of everybody in my family. Mm-hmm. And that sort of shaped my whole story because I sort of became the leader of the family all of a sudden and the one everybody turned to for anything they didn't understand, from English to then later on medical things.
Wow, that's kind of crazy since you were the youngest and you really took a leading role in the family.
Yeah, in that sense I did, very early on.
So especially in the healthcare aspect of it and helping your family out and understanding, the medical issues, is that what drove you to go to school to become a pharmacist?
In part. In part it was that, and part it was traditionally this is just kind of like what we're expected to do, especially I think the first generation immigrants. You're expected to go to college. You're expected to be a doctor, a lawyer, an engineer, something that your parents and your grandparents see as a respectable career or education. So it was sort of an expectation, and there were only so many choices. And pharmacy school just kind of, and being a pharmacist just kind of fell into my lap, actually.
Once you graduated from pharmacy school, then what did you do as far as where did you work and what did your career look like?
Well, I've always been interested in the business side of healthcare. And I actually, and it's kind of embarrassing to say it now, especially given what I do, but I really wasn't very much about the patient side of healthcare, the clinical side of healthcare, until I actually got into it. So during my last year of pharmacy school, we do clinical rotations for a full year in different organizations. I had to do mine at a large integrated health system. And I got to see the opportunity of what it could look like when everybody works together, when all different clinical experts work together to help the patient, and everybody represents their own knowledge and expertise at the table. And that experience really inspired me and made me fall in love with patient care and clinical things. And in pharmacy school, we learned a lot about pharmacists being more clinically involved. And in reality, I've never seen that at a local pharmacy. The pharmacist just asks real quick, do you have any questions? And the patient's on their way. But getting into the health system, I got an opportunity to see like, hey, you know what? There is a possibility for it. And I'm the type of person, I have strong opinions and I'm very driven. So I right away started pushing for more and more and more opportunities to do that for myself and for my fellow pharmacists. And that propelled me within the organization. I became a young, loud voice that was pretty pushy and effective. So I started climbing the management ladder, got some experience with technology, but really it's always been focused on the patient experience and just making sure that we do a great job helping patients understand what's going on with them and why they take the medications they take, and trying to work with their doctors to make sure that they're getting the best therapy.
That's really incredible, because typically a pharmacist doesn't do that. They're very friendly, the ones that I've worked with, but they don't have a huge role in patient education. So it's almost like you just really took that and ran with it.
Yeah, and it's really not the pharmacist's fault.
Right.
Pharmacists are trained to do that. Pharmacists want to do that, but unfortunately, the system that they work in, no matter where they work, it forces them. The financial model behind it forces them, just like doctors, to be on productivity model, to be on assembly line, have to see so many patients per day, have to fill so many prescriptions per day to be able to afford to keep the doors open, and therefore it just turns into that nobody really has the time to actually spend educating people or really caring enough
You're
about.
absolutely right. I started in healthcare, many, many years ago at a very young age. It was 1978 is when I graduated from college. But in 1976, I started doing the clinical work in the hospital for respiratory therapy. And things were so different then. You took so much time with your patients. You really took time, researching the chart, working with other professionals. And over the years, things changed to the point where all they were talking about was productivity. You have to do this many treatments a day. You have to get this many hours in. And it was all about the productivity and the money. And it was so depressing.
Yeah, it's and there's also insurance companies put a lot of clinical metrics on the system or the pharmacy as well, that they have to meet in order to get certain levels of reimbursement.
Right.
And these clinical metrics are just some certain metrics that they can sort of keep everybody to, which basically makes us all one big herd, instead of saying like, Cheryl, you have your own unique issues. You have your own unique body. You have your own unique lifestyle. Let me figure out what the right thing for you is. But no, you have, let's say, a little bit higher cholesterol, or you are at risk for diabetes. So we have to put you on a statin for prevention, because that's what a clinical says I have to do. And if I don't do it, I don't get paid as well.
Oh, geez. So when did you become disillusioned by that system?
Basically, early on, I was blinded by the excitement of it, the excitement of the potential. I'm always driven by the potential. So the excitement of the potential kept me going, made me a workaholic, made me want to work harder and do more. But really, I always found myself pushing against the grain. And I think I would have become unhappy and disillusioned a lot earlier, but I fortunately was in a management position that kept me excited. But just looking around me, looking at my classmates, looking at my colleagues, looking at physicians that we worked with, so many people just they were missing the human factor of it, because they were burnt out, they were beat up, they were just a tool in this machine. So for me, that came about 5 years ago, where kind of everything came crashing down. Burnout, realizing how unhappy I was, certain life changes. And I've always wanted to go to business school, and that kind of where the second part of my career came about. But I always wanted to go to business school to get better education. And I thought I wanted to do healthcare administration. So I wanted to be above pharmacy in the health system, and I wanted to impact change in a larger way. But very early on in business school, I had my eyes opened. I was fortunate enough to go to business school in Madison, Wisconsin. And Madison is the home to Epic, and Epic is the largest electronic medical record that health systems use and hospitals use across the country. And because of Epic growing so fast in the Madison area, it really spun up a lot of entrepreneurship and a lot of innovation. And seeing people who were normal people like me, and not your Facebook founders or Google founders, but normal people who started their own businesses, who took a leap of faith in themselves, who took a chance, who maybe failed, but then got back up, dusted themselves off, and then went on to succeed. But they were doing things they were passionate about and bringing impact and change, and it made me very passionate and excited and motivated to try to do something on my own, because I have these beliefs, I have these strong convictions. I see what's wrong in the world of healthcare. And I wanted to change it. And so very quickly on, I just had my eyes opened, and I had a complete career change. And there was no more going back to corporate. There was no more of that. There was just trying to figure out, how do we bring how do I help bring change to healthcare, and what does it look like, and what problem am I going to solve?
Mm-hmm. You are a problem solver.
Yeah, comes with the territory.
Yes, it does. So then what really drew you to functional medicine? How did that turn about or come about?
Well, the journey to functional medicine wasn't immediate. The biggest problem that I wanted to solve in business school, and something I've always wanted to solve, is the productivity driven, the assembly line feeling of healthcare, but not necessarily as a provider of healthcare, but as a patient. I had to take care of my grandparents. I had to do a lot for them. And I just saw how when people don't take the time to listen, when doctors don't have the time to take the time to listen, and my grandparents would go in, be with the doctor for 5 minutes, leave with 6 prescriptions without any idea why it was prescribed. And the doctor didn't even have a chance to understand what was wrong with them. It's like, oh, pain, here you go. Oh, sleep problems, here you go. Or you were depressed, here you go. And, my grandparents are just an example that's closest to home, but then same thing's happening with my friends, other family members, people that I know, patients that I see. And it was just, it made me sick. And so I really wanted to change the fact that we should have a relationship with a healthcare provider. It should not be a transaction. It's a long-term relationship. In doing so, I was always into technology. I always wanted to bring technology into healthcare to improve it, because it seems like there's just better and more efficient ways to do things so that we can free up time to do things that really matter and not have to do the paper pushing or some of the things that we just do because we do. And as I was pursuing a pharmacy business that was going to be more relationship based, I stumbled upon a pharmacy that did compounding, and I was planning to purchase that pharmacy. And compounding is making custom medications for people. And many listeners may not be familiar with this, but those who have food allergies, or those who are on hormone replacement therapy or certain thyroid replacement therapy, they're probably very familiar with what compounding is. And talking to the patients who were coming in for some of the compounded medications, I got to understand that there is another type of doctor out there who I wasn't aware of. Patients would come in after seeing 6 to 10 doctors in the last year with these crazy symptoms that nobody could figure out. And they were put on all of these crazy medications that gave them all of these side effects, or didn't do anything and cost an arm and a leg. And then they would tell me, I found this doctor who saved my life. And this was patient after patient. And it wasn't the same doctor. It was just the same type of doctor: integrative doctor, functional medicine doctor, a naturopathic doctor, people that fall into this whole holistic healthcare umbrella. And I was compelled to go and learn more about what this field is all about. And I went to an educational seminar by American Academy of Anti-Aging, which is a huge organization educating thousands of doctors. It's called anti-aging, but it's really in functional medicine, in the root cause medicine of why do you feel the way you feel? Like, let's take the time to figure this out. Let's, instead of just covering your symptom with a prescription, like you're very familiar with, that this is just what we do. Instead of that, let's take the time to understand why. And let's try to solve for the why. Maybe you have heavy metal poisoning. Maybe you have mold toxicity. Maybe you have a hormonal imbalance. Maybe you're having an autoimmune reaction because you have a food sensitivity that you don't know about. And if you figure that out, you can solve people's problems. And if people are willing to work on it, so some people, as I'm sure you're aware, some people aren't willing to take those steps, and they're okay, and they sort of give up and agree to the situation they're in. But other people are not. They're fighters. They want to do other things. And if they're willing to put in work, there's plenty of doctors that can help them.
That's really the key, is putting in the work. But there's something else that you said that is just such a buzzword and keyword that I'm sure everybody's ears perked up when they heard it, because mine did too, is the anti-aging.
Oh, yeah. Anti-aging is, the best way to describe anti-aging is not really that we can turn back the clock, but we can make you feel younger. So we can't turn back the chronological clock. You're 40, you're 50, you're 60, you're 70, you're 80. You are however old you are, but how you feel, your biological clock can be turned back. When I was 32 or 33 when I started having my symptoms, and this is another part of the story that led me to functional medicine, is I was burnt out, and I thought it was just maybe the new normal. Maybe this is what 30s felt like. But I would wake up at 2 a.m, awake for a couple hours, can't go back to sleep, mind racing, needing 2 to 3 cups of coffee to just get clicking in the morning. I could lay in bed for an hour and not get up because I just didn't have the energy to, and just kept delaying. I found myself not focusing well, not thinking clearly, and gaining belly fat, losing hair. All of these things were kind of part of aging, I thought, or a part of maybe being in the 30s, even though I didn't feel like I thought the people around me felt like. But I also worked harder, so maybe I was driving myself too hard. But with anti-aging, what you do is you say like, okay, let's try to understand why you feel this way, and let's figure out what we can do to make you feel better. And if we can make a 50-year-old person feel as energized as they did at 40, if we can balance out their hormones, if we can, with diet or with lifestyle, get them basically feeling the way they felt 10 years ago, 15 years ago, 5 years ago, that's the key to anti-aging.
I really picked up on the one word that you used, because I was even thinking it before you said it, was balance.
Yes. Yeah.
And I think that's what happens is when we do end up with so many, illnesses, diseases, aches, pains, the whole thing, and people just pat us on the head and say, well, you're just getting older. This is what this is what the expectation is when you get older. But instead, it's really about balancing the body and considering some of the foods that we eat and the way they're processed, what our diet is, and how much time we might sit at the computer or being sedentary. It all adds up to really wear and tear on the human body. We were not made to sit. We were not made to eat processed foods.
Yeah, absolutely. And a really great example, it's not mine, somebody used it, so I'm going to repurpose it. But a really great example is, let's think of our body as a computer program, and let's think of what we do to our body and our own decision making of what we put in our body, what we do with our body as a software developer. Everything we do, everything we eat, everything we expose ourselves to is little code. It's little lines of code that tell your body to develop or reprogram itself a certain way. So if you're putting junk in your body is going to process that junk a certain way, and it's going to activate certain pathways and certain conditions or certain things that are not healthy for you, that, like you were saying, you were never meant to be exposed to. And we actually see this when we look at people's genetics. And when we look at somebody's genetics, we can say, oh, look, you're predisposed to having these issues because one of your enzymes is not, let's say, able to take folic acid out of food and turn it into the type of folic acid that your body can use. And where that person would probably, if they hadn't known that information, continue going down a path where they would develop that disease. But now knowing that we know that, hey, if we supplement with a certain type of folic acid, or if we eat more foods that have more folic acid to increase our chances to create that healthy type of folic acid that the body can use, we can prevent those diseases. And I think the statistic out there is we're about 20 to 30% predetermined of what our genetics will do. And the rest of it is how we activate them. Turn them on, turn them on, turn them on, turn them off.
So that's actually giving us an awful lot of power.
Oh, a ton.
In our own health, rather than just sitting back and being a victim going, well, my mother had this, and so I'm going to have it, and I guess I just have to follow, along, and this is going to be my future. Yeah,
you know what? Victim mentality will absolutely lead us down that path. Yeah. And the rebellious mentality saying, no, I do not accept this. I am in control. That changes everything.
Well, you're talking about the warrior mentality, and so we're all about that here too. So I love that. But a lot of people would rather just say, it's too much work. I accept it. I'm going to go down this path. Give me the pill. And that's their choice, and that's fine. But there are a lot of us out there who really want to fight it and go down fighting. It's looking into every opportunity that we can take advantage of to maximize our health and maximize our lifestyle and our level of function.
Yeah, absolutely. And there are many people so there are many people who are healthy and they just want to stay healthy. They don't want to get what their mom had, what their dad had.
So when you were in your 30s, and I think of early 30s as being so young, but I was actually in my 30s when my health started falling apart. And, I was a chronic pain patient for 2.5 years. I think I told you that. And I was
Hmm.
poo-pooed by a lot of the physicians that I went to, that it was like, well, you're getting older. What do you expect? You're never going to go back to ballet class. You're never going to be able to do your laundry and your grocery shopping all in the same day because the arthritis in your spine is so severe. You're going to end up bedridden. But don't you worry. And they'd pat me on the head. We'll take care of you. And I'm thinking, this is not the life that I want. So when you were going down that road and you were falling apart, how did you turn things around?
Well, initially unsuccessfully. So initially
Oh,
it was going down the traditional medical pathways or path. It was going to primary care doctors who would tell me that I must be depressed because I was low on energy. And, I could take an antidepressant, which I really didn't want to do and didn't. I should exercise more and get more activity. I was having gut issues. And so I went to see a few GI doctors and all the labs came back normal. So, everything was fine. There wasn't really no solution. But then when I got into functional medicine and I ran some tests on myself, and that's another thing I want to mention is that our body, we have access to so much information about ourselves that unfortunately majority of us will never get to see, because we are in this insurance-based health system where every lab test that a doctor runs has to be justified to an insurance company so they can get paid for it.
mm,
And it can't be either out of your personal curiosity, like, hey, I want to understand what my genetics say about me.
mhm.
And it can't even be out of these things that are maybe don't have a ton of evidence behind them, enough to move the insurance company to pay for them, like looking at your microbiome, the gut, the gut makeup or the bacteria makeup of your gut. But we have so much information inside of us that's just fascinating, and it can tell a whole story, and it can also tell us where to look and how to fix it. And that's what happened with me. I did a test on my hormones. I looked at my cortisol levels. That's our stress hormones.
Mhm.
So that's people who are go 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 go. There's two categories, or probably more than two, but there are a number of categories that fall into this group of something called adrenal fatigue. That's kind of the common language term for it. Actual term for it is HPA axis dysfunction. But cortisol levels are high in people who are go, 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 go. They're also high in people who've been through trauma, people who have a lot of anxiety and worry about things. They're stressed themselves out. Their body is constantly going through fight or flight.
Mhm.
We're not designed for that. We're not designed to run away from bear all the time, or from a tiger or whatever. We're not designed to go through starvation all the time. But when our cortisol levels are high, it reprograms our body. It tells our body, hey, you are not at the right phase of your life to have children. You don't need these sex hormones. Instead, you need to survive. Therefore, we're going to save fat for when you're going to run out of food, and we're going to pack it around your stomach, around your belly. We're going to reprogram certain things to your immune system. We don't really need it right now because we're worried about not bleeding out if we get into a fight, not about catching some bug. So people end up getting sick more. They're packing on this belly fat like I was. My testosterone level at 32 was that of an 80-year-old man.
Oh, God.
I mean, it's crazy. And I would have never known. But so that's kind of phase one, is like you burn, your cortisol levels are really, really high because you're constantly on. You're constantly go, 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 and stressed out. But then you eventually start running out of juice. And it's not the best explanation, not the most clinically accurate, but it's the best explanation that I find resonates with patients when I tell it to them. It's
Mhm.
you sort of start running out of juice, and then your cortisol levels just can't keep up with the demand. And the way that we make cortisol is from the same things we make the rest of our hormones. It's from cholesterol. And when we need more cortisol, we're not making the testosterone. And that's what happened with me. Is I needed so much cortisol that it took away from the cholesterol that was supposed to go to make my testosterone.
Mhm.
But eventually, when you run out of cortisol, or you run low on cortisol, you start feeling really fatigued. And that's kind of the second and third phase of adrenal fatigue, is where you just feel miserable. You don't have enough energy. Your body just can't produce it. And then things really start falling apart. The other thing I took a look at is my neurotransmitters. I wanted to see what's actually happening with my serotonin, with
Mhm.
my melatonin, with my dopamine. And that was very eye-opening. And once you put those things together, then you start realizing, okay, so I need to support these specific functions. So there's nutrition support, which would be getting more vitamin Bs, getting more vitamin C, healthy omega-3s, could come from supplements or from food. But there's also a lot of lifestyle changes here, which is like, hey, man, you got to slow it down.
Mm-hmm.
You can't be on overdrive all the time. You can't be functioning on coffee just so that you can deliver.
Right.
And then is deliver to myself. Meditation, smiling, laughing, enjoying friends' company, positive emotions to suppress the negative, the anxiety, the stress.
Mm-hmm.
And that's the balance again.
What blows me away is in understanding all of this and how the human body is so beautiful in the way it works. I mean, everything will work so well if it's given the right environment. And so many diseases and so many problems long term down the road can be prevented by this. And I just think of how much money the insurance companies could save with older people once they start, falling apart and going down that downhill spiral, if they would step in and provide the preventative medicine and the preventative care.
It's sad, but if you think about the financial incentives, nobody cares.
Yeah.
Because the financial incentive is for me to cut costs this year. My bonus as a executive depends on performance this year, maybe performance over the last 3 years, maybe over the next 5 years, depending how long I plan to be with the company. Longevity of somebody who's with my plan, my health plan today, and how they will be in 10 years,
Mm-hmm.
I have no incentive to care about that.
Mm-hmm.
And that's the sad part, is there is no long-term view. It's all short-term because it's short-term rewards. And then, it sucks because insurance companies don't pay for the things they should, and therefore the things that should be done don't get done.
Oh, that's just so frustrating.
And my company, Vytal Health, we're operate outside of the insurance model. And so do so many functional medicine doctors out there, because that's really the only way to put us and you as a patient in control.
Mm-hmm.
Let's do the things that make sense.
Mm-hmm.
And when you don't have the crazy overhead of a large health system, when you don't have the crazy overhead of working with insurance companies and running an insurance company and everybody who has to make $1 along the way, when you take that away and it's just you and the doctor, things are a lot more affordable than many people would think.
Mm-hmm. And magic happens too at the same time.
Yeah, of course. And the right doctor,
Mm-hmm.
the right doctor will actually take the time. They will take the time to listen. They will take the time to understand your story, your life. And they'll start turning over different stones that have been unturned for decades,
Mm-hmm.
and looking for what went wrong and when,
Mm-hmm.
or what could go wrong and how do you prevent it. And when you think about the body as a whole, because the other thing that, I'm talking a lot of smack here about our healthcare system, and we have a great health system, but unfortunately it's a sick care system. It's
right.
It's great when we're sick, and sick, not even with every condition, but in general, it's
Mm-hmm.
great when we're sick, when we need a surgery, when we have a broken arm, but it's not great at keeping us healthy. So it's not really a healthcare system, it's a sick care system.
Mm-hmm.
But taking a whole person approach, when the doctor looks at you, not just as a specialist for arthritis and looking only at arthritis or looking only at your gut health, like a GI specialist, but when they look at everything as a whole, things connect. It's all one organism. It's just different symptoms show themselves differently. Like, for example, I don't know if any of your listeners, or if you've had any of the presenters on your show talking about leaky gut, but leaky gut causes eczema. So where you go to a dermatologist with these skin conditions, the reality is it's really not the skin condition, it's the autoimmune condition that's caused by the fact that you have, over the years, caused enough inflammation inside of your body, inside of your gut, to allow things that were never supposed to get into your body to start getting into your body.
Mm-hmm.
And instead of working on a cream that covers up the symptom of eczema, you really should be working on what you're putting in your body to heal that gut, so that your immune system is not constantly on attack and ends up attacking your own self.
What I had to find out on my own is that my healthcare is basically my responsibility. And I have my, traditional practitioners, and I also have a group that I use and refer to, for non-traditional, for alternative medicine. And that is my responsibility. to be able to take care of my health, to be able to go to these other experts who are outside the traditional medical field, because they have basically saved my butt several times, more than once. And so I just think that's part of the whole package. If we just rely on traditional medicine and that's it, we're doing ourselves a disservice, because there are so many alternative practices out there that can really help us, not only with functional medicine, but other modalities like cranial sacral therapy, meditation, massage, Reiki, Feldenkrais. There are so many other things out there that if you don't explore what the options are, you're doing yourself a disservice.
So I'd like to zoom out just one step further and say that until people realize that they're in control, that they're driving the bus, that they are ultimately the ones responsible for their own health, and don't rely on somebody to tell them what to do all the time, because that limits their options. So until you figure that out, I think you're kind of stuck. Somebody else is in charge of your destiny.
The way I put it is that you are actually relinquishing your power and handing it over to somebody else on a silver platter.
Yes, exactly. And unfortunately, even if the doctor is wonderful and they're great, unfortunately, they only have 10 minutes to think about you. How much can they really put in? And they're also limited by their own knowledge, because medical school teaches what it teaches, pharmacy school teaches what it teaches. We learn things that we have to with continuing education or want to after graduating and ongoing. But everybody's knowledge base is limited. When you are your own advocate for healthcare, when you say, you know what, I am in charge, I'm going to go consult this expert, I'm going to see what they say, I'm going to consult this expert, I'm going to see what they say, I'm going to do my own research, and then I'm going to put it all together and I am going to make an educated decision.
Mm-hmm.
I mean, that's where it's all, that's
empowerment. That's empowerment.
Because so many people just give up. It feels like a huge mountain of medical information to climb over, that they just throw up their hands. They're like, I don't know, just tell me what to do. And
when you do your own research and you've got the information behind you, when you do go to your traditional practitioner, you're actually doing them a favor, because it's like, okay, I've researched it. This is what I'm feeling. This is what I find. This is what I think. You have a lot more control and a lot more information for them to work with too. So they're not, those few 10 or 15 minutes that they've got with you, they can actually make the most of it.
Totally. And that's true, not just of traditional medicine, any doctor, any clinician you go to, the more prepared you are, the better things are going to go. However, unfortunately, oftentimes when people do try to do that in our rushed transactional system, they're looked at as a crazy person. They're dismissed. The doctor doesn't have knowledge of this. Honestly, my opinion of some of these things has changed so much. And had you come talk to me 5-10 years ago with all of your research, I probably would have looked at you like a crazy person as well, and saying you're doing all these things that don't have proof, or we're told not to do them. And yet now it's a completely different outlook and completely different approach.
Thank goodness. That was one thing I wanted to ask you when you were telling us your story about in your early 30s and you were falling apart, and the doctor saying, well, you must be depressed, and had all these tests and stuff and everything came back normal. Did anybody tell you were crazy?
No, but it is something that we hear time and time again with our patients.
I was told I was crazy several times.
Yeah, no, I didn't get to that point. And I think it might also be different between men and women,
I think
honestly. So. But so many of our female patients, when they come in and they finally have this 1-hour visit with the doctor, and the doctor listens to them and reassures them that they're not crazy. It's not all in their head. People break out in tears.
I know.
I got to say, it's probably over half of our patients that come in during their first visit, they break out in tears because they're finally being heard. They're finally being believed. And
not only that, they're given hope.
Yeah, oh, absolutely. Because especially like in your story, oh my God, the hope was snatched from you.
Oh,
and
yeah.
Without hope, you have nothing to work for. You have nothing to look forward to. If you can't improve, then why would you try?
You really basically have nothing to live for.
Exactly.
I mean, that person who told me that, I mean, she shattered my dreams. She destroyed my spirit. She took away my hope. I mean, it was like, what am I supposed to do? And I went home and I hit rock bottom. And a few days later, I found my fighting spirit. And it was like, no, I am not going to accept this. I'm not going to live with this. So I basically decided to do it on my own. I fired all my doctors and my physical therapists and stopped taking the medication, stopped doing the stupid exercises and stretches because they weren't working. And all I did was acupuncture. And I got down on the floor every single day and I taught myself how to move again. And it took a long time. It took at least, 6 to 9 months, but I finally was able to break that pain spasm cycle. The predictions that they had given me, had I listened to them, I wouldn't be talking to you right now.
Yep. What pushed you to say, screw this? There's got to be a better way. Like, what was that picked you up when you were at your lowest?
Well, I don't even remember. It was just because I was depressed at that point because, I was living with this incapacitating pain for 2.5 years. And I think it was the fact that when she said, oh, you're never going to be able to do your grocery shopping, your laundry and all the same day and blah, 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 blah. And I just looked at her and I said, you don't understand. I'm planning on going back to ballet class. And she laughed in my face and said, number one, you're too old. You're not 18 anymore. Ballet is for, kids. And it's like, okay, here I am. I'm 63 and I'm still taking ballet class now again. I mean, it was just the fact, I think, that there must have been something deep inside of me that was so enraged that I would be treated that way and I would be so dismissed. I do have a history of chronic pain when I was much, much younger. In my 20s, I mean, horrible pelvic pain, unbelievable. And I would just fall to my knees and double over. It was just so awful. And of course, went through all the testing and stuff and, oh, there's nothing wrong with you. And, I was told I was crazy. I was told I was drug seeking. I was told a lot of things. And then I just stopped complaining about it and decided, I'll just deal with it myself and shut up. So I think it was just having a repeat of that somebody was dismissing me and not giving me any options. That I don't know. There's something deep inside of me that, said, no, you have to fight back.
Yeah. Just one observation that I think the fact that you were so dismissed and your dreams were so shattered is what gave you the energy and this fight to fight against it. And I think that had you been treated with more empathy, but the same way, you could have potentially gotten stuck in what you were experiencing back then. So it's almost having that terrible experience is what gave you the strength, it seems like.
That's a really good observation. And I think you're absolutely right.
We see this a lot too with our patients is those that choose to say, no, screw this. I'm going to find a better way. There's got to be a better way. Are the people who've really been mistreated and who've really reached that point of no return. And I really wish that people were more aware of options that they have at their fingertips, especially with, my company, Vytal Health, or other companies out there, especially now with telemedicine. You have access to wonderful doctors in the comfort of your home. It doesn't get any easier than that. You just have to know and trust that there are options out there. And it's very sad that people don't.
It is, but that's why we're talking about it now.
Exactly.
And that's why we're having you on the show.
Glad to be here. Glad to spread the gospel.
Amen. So tell us about your company and tell us about your partner, how the two of you got together and you created this incredible company in actually a fairly short amount of time.
Yeah. So actually my partner, Dr. Tiffany Mullen, we've known each other for well over a decade. In my early career in the health system where we both worked together, she was the lead physician of the integrative medicine department. She actually started as the first physician there and grew it to 22 doctors and clinicians who specialize in integrative and functional medicine. Early on in her career, her and I worked together on a couple projects I was trying to bring in more complementary medicines, alternative treatments into the pharmacies, because I always thought that there's got to be something else other than just prescriptions for people, something to go along with their prescription, or maybe something instead of their prescription. So we worked together and became friends. We lived near each other, shared patients, referred patients to each other, and kind of became buddies. Her story is really fascinating and terrible and sad and happy at the same time. She was diagnosed with juvenile rheumatoid arthritis when she was 16 months. Oh. She's been a patient her entire life. She's seen the best, she's seen the worst of it. And that's what led her to become a doctor and become an integrative doctor from the very, very start. She wanted to practice medicine differently. She wanted people to feel differently. She didn't want anybody to go through what you went through, to have the type of doctor at your bedside who would shatter your dreams, who would not continue to peel the onion and try to understand what else could be done, what else could be done, what else could be done. And she knew that there was more than just prescriptions to getting people better. She became trained in acupuncture. And she's always had this kind of whole person, holistic, integrative approach to the way she treated patients. The patients loved her. Being in a large health system where you're one of many and you're always going against the grain, it's very taxing. And especially because you are trained to spend an hour with the patient, maybe 45 minutes to an hour, to really try to understand them. And the system is pushing you into a 10 to 15 minute appointment. Otherwise, you just don't make enough money. And you're either going to lose your job or you're just not going to make enough money to support your family, which is kind of crazy, but that does happen with doctors because of the productivity model. And my passion for creating relationships and creating a healthcare environment where people really feel loved and cared for. So there isn't this black hole that happens to all of us where we go see a doctor and in between visits, we're in the black hole, we're on our own, we feel completely alone. And in a regular medical, even like in the way medicine is, period, whether it's functional medicine or traditional medicine, it's hard to get a hold of the doctor. You call, you leave a message, a medical assistant will call you back with a message back from the doctor. You never get connected until you come back in. Doctor has no idea what's happening with you. They can't adjust your treatment. They can't course correct by getting additional information from you. So we go into this black hole. So I wanted to change that. And as I learned more about functional medicine myself and experienced improvement of my symptoms with the right treatment and understood that we've been doing it all wrong, that's when there was just no turning back. And that's where Tiffany and I really started seeing eye to eye as to what we were trying to change in healthcare. And we came together and we formed Vytal Health. And really the goal was to bring humanity back to medicine and to practice medicine in a way that makes sense, where you're looking for the root cause of why do people feel the way they do. And then you give them the proper treatment, proper support, and proper encouragement so they don't feel hopeless, they don't feel on their own, they don't give up. And it leads to fantastic results. And our company has been fully virtual from the very start. We believe that majority of what we do in office can be done over video. A lot of what we do is listen. We're detectives. We're listening. We're trying to understand, uncover. We offer in-home lab testing. So you don't have to go really anywhere. You just get everything done at home. And this way, we're able to bring experts from across the country to you. In the part of the country where we live, we have very limited number of functional and integrative medicine physicians. Many people have to wait 3 months to get in to see somebody. And while many doctors in the area are great, but they're only specialists in a certain field. And they have to be generalists, but they're specialists in a certain field. There are many specialists around the country. What if you made them available to people?
Wow.
And connected them when you need them? And that was our premise for being. And it's to practice medicine the right way and to treat people how people deserve to be treated and not worry about what insurance companies want you to do.
So if people want to learn more about your business, about your practice, where do they go and how can they do that?
So our website's wonderful, has a lot of great information, a lot of great blogs and education. It's vytalhealth.com, Vytal spelled with a Y, VYTAL, health.com. We're also on Instagram, Facebook, and LinkedIn, Your Vytal Health. And we're always putting out great content and great education so people can learn. We have wonderful doctors. We're able to see patients right now in 26 states. And I think with COVID and what it's done for telemedicine, I think pretty soon we'll be able to offer our services nationwide. We have a great support network for our patients where they can see their doctor, they can message their doctor between visits. They have a personal care concierge that helps them navigate everything.
Wow.
So that they're not lost and confused. They work with the pharmacist. Many of them work with me to adjust their supplements or to answer questions about their medications or even just give them a little motivation and support because everybody needs that sometimes. They need a little hand holding, a little push.
I love the education part of your website. I hope everybody takes advantage of that and checks it out. I did see your website. It is beautiful and very informative. And the more you understand about how your body functions and what is available out there, the more power you've got.
Absolutely.
Knowledge is power.
Knowledge is power.
Okay. So is there anything you'd like to leave the listeners with, or before we wrap up?
Well, I just think that people need to just be reminded and encouraged that they're in control. Our bodies and minds, they're extremely strong. They're resilient. We just have to support them the right way. What we do in our lives, what we put in our mouths, what we expose ourselves to is like software developer programming, what's going to happen to us. And people shouldn't settle. They shouldn't settle for it is what it is. They shouldn't settle for a mediocre doctor just because that's who's available in their community or in their insurance plan. These decisions are so crucial. You have to make sure you have the right doctor that you feel awesome about. And it takes some shopping around. And the other thing is being in control. If you come prepared, you come with education to your appointment, and you observe the doctor's reaction. If the doctor's interested, genuinely interested, then you got the right doctor. And maybe they don't know everything, but maybe they'll be able to point you in the right direction. But if you're getting dismissed, if you're getting shoved out the door after your 10 minutes is up, and the doctor really doesn't take enough interest in what you brought forward and respect your intelligence, your level of expertise, and your own knowledge of your body, you got the wrong doctor. You change your doctor, change them quick.
Mm-hmm. Thank you for that. And that's a really important point of watching your doctor's body language and expression, because you can really get a lot of information from that and how they might be feeling about you.
Yeah, absolutely. And I think the last thing is how do you find the right doctor? Many people turn to their insurance companies for who's in network, but I would turn to the community. I would turn to my friends. I would turn to people who seem like they may have similar issues that I have or similar struggles that I have.
Mm-hmm.
I would go in search for a functional medicine doctor locally. I would go to local, small, independent compounding pharmacies because they know who these doctors are because they're getting prescriptions from them. They'll know the feedback that their patients are giving them. You can do some Google searches online. Again, Vytal Health is always a great option because we're virtually available basically to half the country right now. But there are so many ways to find that right doctor for you. And, I just hope people to really shop around and try to understand and take control of their health.
Excellent. Well, Alex, thank you so much for being with us today. I really sincerely appreciate it. I've learned a lot. I think you're doing fantastic work, and I just love talking to you.
Well, thank you, Cheryl. It's my pleasure, and I love your story, and I love what you're doing here. So definitely glad to come back and talk more.
I would love to have you back anytime. You just let me know. I know you've got a lot of exciting things kind of brewing right now with your company and your practice. So I would love to have you back, and you can keep us up to date with that. Okay?
Sounds good. Thank you.
Thank you. And thank you for listening. I really appreciate it. And remember, you do have choices in your healthcare. Do your research and pay attention to your body, and just understand that you really do have choices, and you are the one who's in control, because that is the way of the FemiNinja. And that's a wrap on another episode of the FemiNinja Project. Thank you so much for listening, and remember, be safe, be strong, and until next time, bye now.